Everyone, this is Libby, and today I'm going to be talking about medieval surgery. So, in the medieval times, surgery was rudimentary and dangerous. Few patients survived surgery, and there were three main problems with surgery in medieval times. The first was pain. Surgery was excruciatingly or very, very painful. No anesthetics existed, and only natural anesthetics like hemlock or opium existed to numb the pain. Natural anesthetics were dangerous because high doses could kill the patient. The second is infection. There was a very limited understanding of what causes diseases and infections. Nobody had discovered the link between dirt and disease, and many doctors believed that pus in wounds helped a patient to recover. Many people died from infections after surgery. And the third problem is blood loss. Patients often lost a lot of blood in surgery. There were not blood transfusions or anything similar then, and blood loss could also be fatal. So, as we just discussed, surgery was so painful because no artificial anesthetics existed. And infection and blood loss could be fatal in medieval surgery. So the common surgical processes, to discuss now. So surgery was not a respected job in medieval Europe. Lots of surgery was performed by barber surgeons. Some military surgeons learned skills to treat wounded soldiers on the battlefield. And the most common surgical procedures were bloodletting. So unlike doctors, there was little formal training for surgeons. Training was through apprenticeship. Surgeons performed bloodletting when humours were imbalanced. By removing blood, it was believed a patient would become healthy again. Amputation. An amputation was when a surgeon cut off a body part. This was often needed if a body part was painful or infected through wounds. Given the scale of blood loss, amputations were very dangerous. Trepanning. Trepanning was when a surgeon would make a drill hole into a human skull. Surgeons used trepanning if patients were acting abnormally. This included being possessed by bad spirits, having a mental illness, or suffering from epilepsy. And finally, cauterization. Cauterization was when surgeons burned a wound to stop blood flow or close up an amputated wound. So lots of surgery in medieval Europe was performed by barber surgeons. Who were licensed to cut hair and do minor surgery. And bloodletting was one of the surgical procedures they used, which is where blood was removed from a patient. Medieval progress in surgery. There were developments in surgical procedures in the medieval period. Albicasis is one of these. In the 11th century, Albicasis, the Islamic physician, wrote Al-Tasrif. This was a 30-volume book on medicine. He also invented surgical instruments and popularized cauterization. The Hugh of Lucca. In the 13th century, Hugh of Lucca argued that pus was bad for a wound, and he began to use wine to disinfect his wounds. However, he did not succeed in overturning the dominant idea that pus was necessary for wounds to heal. Mondino de Luzzi. In the 14th century, Mondino de Luzzi pioneered anatomy. He popularized dissection and wrote Anatomia, which dominated medicine until the 16th century. And finally, John de Ardon. Remembered as one of the most famous surgeons in medieval England, John of Ardon established the Guild of Surgeons in 1368. He based his book Practica on his experiences in the war with France and his knowledge of ancient Greek and Arab medicine. Ardon created his own forms of painkillers from substances such as opium, which is a natural anesthetic, as we discussed earlier. So, to recap what we've just learned, we know that Hugh of Lucca was in the 13th century, Albicasis was in the 11th century, and Mondino de Luzzi was in the 14th century. And that John of Ardon established the Guild of Surgeons. So, some examples of natural anesthetics in medieval Europe, which we learned about earlier, are opium and hemlock. And to recap on the 4 common surgical processes, we know that they are bloodletting, cauterization, amputation, and the drilling of a hole in the head, which is called trepanning. So, in medieval times, there was a very limited understanding of what causes diseases and infections. Nobody had discovered the link between dirt and disease, and many doctors believed that pus in wounds helped a patient to recover. So just to look at those common surgical procedures again, we know that one is bloodletting. This one here is cauterization. Down here is trepanning. And finally, amputation. And then to look at the different pioneers of medicine, we know that Hugh of Lucca was in the 13th century, who argued that pus was bad for a wound. We also know that in the 14th century, Mondino de Luzzi pioneered anatomy, and Hugh of Lucca began to use wine to disinfect his wounds instead of pus. Okay, so that's everything I'm going to be talking about today with regards to medieval surgery. Thank you so much for listening.